So the consent, before taking the consent, patient should be duly explained about the disease, the use of rituximab in the disease, its effect in disease, course and prognosis, and the side effects that may occur during the treatment. So in this case, she is a 25 years female, and she is a relapsed case of pemphigus vulgaris, and the consent has duly been taken. So while considering the consent, it must be written clearly that what are the side effects that may occur, including the death, secondary to anaphylaxis that may occur, and the consent must be given if the patient is older than 16 years by patient herself, along with the one close related family members from the patient. So consent has been taken in this case. And before administration of the rituximab, so the investigations should be rechecked before investigation. So in this case, the investigations have been done, so which includes the serology, including the HIV, SBSHG, anti-HCV, herpes simplex virus 1 and 2 IgG and IgM, and BDRL, which are negative and non-reactive. The chest X-ray was normal. Montax test was done, which was less than 5 mm. Blood culture, urine culture, and the lesional swab was sterile. And the renal function test, liver function test was normal. And after that, the physical examination of patient is done before starting the treatment. And this physical examination was within normal limits. So now the drugs have to be prepared. So there is a drug chart separate for the infusion as well as the syringe pump. So the drug is brought, and hydrocortisone 200 mg for adult, and paracetamol 1 gram should be started 30 minutes before the infusion. And the third is the injection Avil, or that is chlorpheniramine maleate 44 mg, 45.4 milligrams for the pre-medication. And at the same time, the vial for the hydrocortisone, atropine, adrenaline, and deriphylline should be loaded and kept ready for in case of emergency. Apart from this, the other instrument for the intubation includes the laryngoscope with curved blade as Macintosh should be checked before starting the rituximab infusion. And here before starting the infusion, now the chest lead must be kept in the patient. So this will be demonstrated now. Now we will demonstrate the placement of the chest lead. So one should be on the right lower chest, that is above the left hypochondrium. Next on the left infraclavicular area. And third on the right precordium, that is right infraclavicular area. And I have position on the stand, and it is connected via bolomate line. So since this infusion pump, it only supports the pharynxis cavity bolomate line, so pharynxis cavity bolomate line is taken. So in this there is a green tubing, which is the site for the insertion, site of the insertion, and there is a triangular knob that is placed, which is for the pressure line. So it's for the pressure line. So we insert this on the green line, and we make sure that it fits snugly within this knob, and it is taken out. And once it is done, the infusion pump, the door is closed, and then it has to be checked for the pressure line. So we can start the checking the pressure. So here it demonstrates the pressure check, and we must make sure that all the lines are open during this pressure check. So now it shows that the pressure is okay. Now from this we should start setting the infusion setting. So this green button, so we can change the direction. This is the change menu. So we changes the flow rate as well as the duration. So this first which is given is 96.4 ml. So this is the amount of volume that is going to be infused, and this it gives 00H58, that is 0 hours and 58 minutes. So this represents the time. So in this is the place where we set the infusion rate. So now let's start. So first So initially we are going to infuse at the rate of 12.5 milliliter per hour. So we should decrease this with this up and down button. So this the one with the two arrows, which is for the large volume decrement, whereas this small arrow is for the small volume decrement. So once we set in 12.5 ml, now we want to set this for 1 hour. So this we give 1 hour, and from this small. So now we have set it as 1 hour. So once we press OK, now we can start the infusion in this rate. And so the process of connection of the cardiac monitor. So now this green 3 wire, this is for the chest lead, and this blue one is for the pulse oximeter. So the green one, so it has been clearly mentioned. F means it's for the foot. L, which is left, is mentioned, which is for the left side, left precordium, and R is for the right precordium. So let's begin with the placement of the chest lead. So first we'll connect from the. So we'll start from the right lower quadrant. So we connected the foot one. Then we connect the right side, which is connected, and from the left side. And in order to check whether the connection has been properly placed or not, we should look into the monitor. So in the monitor, so once it is properly placed, it has to show the ECG line, which will be showing over here. So we should wait for some times till it shows the proper ECG line. So once this, now we'll place the palm of the finger on this red light where it blinks the red light, and we should keep it for some time. We must make sure that both hands are warm in order to get the readings in the pulse oximeter. Now the pulse oximeter reading has been taken properly. Now we'll go for the pre-medication. In pre-medication, we are going to administer 200 milligram of hydrocortisone, 1 gram of paracetamol given orally, and 1 ampule of chlorpheniramine maleate. It's a slow dose of chlorpheniramine maleate injection. For preparation of the Rituximab infusion mixer, so the 400 ml of normal saline should be mixed with the 1 gram of Rituximab. So in this Rituximab, so each vial comes of 500 milligram in 50 ml. So we need is 1 gram, so which is equal to 100 ml. So it should be mixed with the 400 ml of normal saline and 100 ml of the Rituximab, which gives a total volume of 500 ml. So carefully, 100 ml of normal saline must be withdrawn from the normal saline bottle or bag, whichever is available. So for this we have a separate opening where it is mentioned as out, so from where we can withdraw the fluid. So we should keep the bottle in a vertical position and then carefully withdraw the. So this time we withdrew the 50 ml. So either we can keep this 50 ml or discard it. So now the volumetric line is being connected to the intravenous axis, and once it has been connected, so now we'll make a mixture of the Rituximab infusion. So Rituximab must be stored in the temperature of 4 degrees Celsius, and cold chain should be maintained. And so we'll take a syringe, 50 ml syringe, put a little of air in the vial, and then we'll withdraw the Rituximab. And Rituximab is taken in this syringe, and from this port,
medication has been administered and Rituximab has been infiltrated into the NS, and now we monitor the vitals every half hourly, and we'll start the Rituximab half an hour after the administration of the free medicine.